I'm a clinician-scientist, so I study for many years epilepsy from the bench all the way to the clinic. Then we try to translate things to patients that hopefully can provide some relief or cures or effective treatments for some of our kids with severe epilepsy syndromes. The epilepsy syndrome that I would say place most of my time on, as far as research is concerned, is infantile spasms, and that's a debilitating form of epilepsy to affect infants. The current treatments for this condition are not effective in about half of the patients. So, I'm trying my best to develop safer, more effective treatments for these kids. You may ask the question, well, okay, this is a bad epilepsy, but what really is the outcomes if you don't have effective treatments? Well, if you have a mom that comes to you with this condition, they often say, oh, my child was normal, growing nicely, smiling, sitting up. All of a sudden, no longer smiling, no longer sitting up, lose all their milestones. They're having these weird events every day, hundreds of times a day. You get the EEG, which is the recording of the brain waves, and what you see is something chaotic on it. You have to tell the parents, wow, your child has this condition. You offer 2 medications. One has about 15 side effects, including death, and then the other one can make you blind. But then on the other hand, this condition can also lead to death and can make you blind. And the poor parents are sitting there juggling what to do. We have to do better for these kids. And if we don't find effective treatments, they may never walk or talk again, may not go to school. It's just terrible, it's catastrophic. So we really need to find some effective treatments, or at least to improve the effectiveness of some of the treatments that we have already available for these children. So this is a historical endeavor that goes back to when this condition was first discovered. So it was discovered in the 1800s by somebody named William James West, and his own child. And he published this one beautiful description of this condition as a cry for help. And over time, we developed certain treatments like hormonal treatments like ACTH or prednisolone or vigabatrin, but we weren't able to go further because we didn't have animal models for this condition. So the first animal models came out only in 2006, so that was maybe 175 years after this condition was described. While I was a postdoc, one of the scientists who actually developed one of the first, if not the first, animal model of infantile spasms. So now we go from 2006 to 2026, and now we're learning from the models that we have various mechanisms, and then we can now provide targeted treatments. So in our laboratory, we've been looking at various mechanisms involving the impact of the ketogenic diet on this condition. The ketogenic diet can be just as effective as some of the other treatments I told you about, but it's often difficult to give and has intolerable side effects sometimes. So we have to find a way of understanding how the ketogenic diet works in these new models of infantile spasms, right? And maybe we can, from what we learn, we can develop a targeted treatment. So we've looked at the ketogenic diet, and we believe from the preponderance of the data that the microbiome might be one way in which the ketogenic diet works in these children, or at least in the animal models, to suppress spasms. So and the ketogenic diet has been tested in adult animals, and the microbiome has been looked at, and they've identified certain microbes that might be important for seizure control in relation to the ketogenic diet. But those microbes are not the same in baby animals. Different mechanisms are occurring, and we've discovered these specific mechanisms. Through the discovery of these specific mechanisms has led to this, not only to the study, but it's improved our understanding of how the ketogenic diet may work in immature animals, and it's helping to improve our understanding as far as the role of the gut-brain axis in the control of epileptic seizures. So this is the gut-brain axis neuronal excitability seizures, a specific for baby animals, they're for children. And we've targeted and we discovered that potentially it involved the enhancement of two specific microbes. So we've shown that when we did targeted treatment in the animal models with these two microbes, we saw a significant impact on the seizures. So we're moving now and said, okay, are these microbes safe? Yes. Do we understand the mechanisms of action of these microbes? Somewhat. So let's bring this to patients, not necessarily as a independent treatment, but as an adjunctive treatment to some of the medications that we're using thus far. So that's where we're going with this. And we're happy to partner with Lallemand to get this done and bring relief to some of our patients with this terrible condition.